Hello, hello. Happy 4th of July, everyone. It's Dr. McJunkin here. And today we are going to talk about quality of life and the condition called overactive bladder. And so I hope you guys are doing well. It's been a couple weeks since I talked to you. I was in Guatemala on a medical mission trip, and my family came, and it was a wonderful experience. So today, this is an extremely important topic, and we're going to talk about why managing or helping your overactive bladder improves quality of life. So there's going to be a couple of things that we talk about, but before we jump into it, I think quality of life is something that we all understand. So all of us understand that quality of life is critically important for all of our goals and for family and for relationships and everything that we do. But what's interesting is actually quality of life has been defined pretty well in the medical literature, and it's actually broken into several different subtypes. And as I tell you kind of what those are, I think it'll actually make sense to you. And so there are several different good testing measures where we can look at quality of life. And the reason we look at quality of life is because we want to know, does, let's say, having a condition like overactive bladder, does that affect people's quality of life? And if it does, and I think all of you guys would just say, yeah, that's really obvious. But if it does, it becomes much more important to treat that. So it's broken down into several different categories. But the categories generally are physical function, bodily pain, general health, vitality, social function, emotional, mental health, and then kind of an overall physical. And so I'm going to go into those in a little bit more detail. So physical really looks at limitations or stopping certain activities. And then we look at disturbed sleep for physical, difficulties concentrating, tiredness, and even eating behaviors and drinking behaviors and things like that. So let's just talk about the physical aspects of overactive bladder and really why this affects your quality of life. Physical limitations, well, I think many people experience a lot of limitations having a bladder problem. And some of those could be as simple as, I have trouble going for walks around the neighborhood because I might have a really strong urgency and I don't want to have an accident while I'm out. Or I don't like traveling in a car because I don't know where the closest bathroom might be and I might have a problem. Or I don't want to go out to lunch with my relatives or my friends, or I can't travel across town, or I had to give up traveling on an airplane. So those are things that we hear basically daily. And so, from a physical functioning standpoint, overactive bladder really affects people's quality of life. Disturbed sleep is a very, very common one that we hear as well. And so, overactive bladder is made up of a cluster of several different, really symptoms. But it's nighttime urination, which is nocturia. And so going more than once per night is considered abnormal. And so if you're getting up 2, 3, 4 times a night, it drastically affects your overall health, but also extremely affects your quality of life day to day. So I saw a lady yesterday, and she's getting up 3 or 4 times at night. During the day, she can mostly manage okay, but she has a strong urgency. But when she wakes up, she just feels exhausted. And then she feels tired the rest of the day. And so you can imagine for somebody like that, living becomes less and less enjoyable, and that essentially is quality of life. And then really getting out and doing the things that you want to do, spending time with your loved ones, with your family members. Maybe she said even going for walks, like she doesn't have the energy for that, even though that's something she knows she needs to do and she used to really enjoy. So disturbed sleep is a really critically important one for people with a condition called overactive bladder. Difficulty concentrating and tiredness, I think those go hand in hand with disturbed sleep. And then, we oftentimes will see people struggle in simple things. I can't go to a movie because I have to get up multiple times. I can't even watch a TV show. I have trouble going out to lunch or dinner or breakfast because I'm leaving all the time. So, my friends have to stop the conversation or whatever that might be. Another aspect that plays into this is sexual, and this is very common for people too. But sexually, people, I think, feel less attractive if they have a bladder or bowel problem, and oftentimes they will avoid that altogether. Domestic, it's very difficult for people if they, let's say, are bedwetting, or if they're soiling clothing, and so it just almost becomes a full-time job, just keeping up with keeping themselves and their environment clean. Obviously, that drastically affects quality of life. Psychologically, all of this leads to things like depression, decreasing self-esteem, and then I think anxiety. All of those things have been pretty well studied with overactive bladder. And so not only does this affect your day-to-day functioning, your level of energy, the ability to take care of yourself in your own environment, but really it starts to affect how you view yourself in the future. And then that plays into socially. It really starts to affect relationships. And pretty soon, a very active person all of a sudden becomes very reclusive, and they have less and less social interactions because they feel like this condition is limiting them, and it often does. And then occupationally, overactive bladder, can affect people anywhere from, in their 20s all the way up to, hundreds. It obviously becomes much more common as we age. But one of my favorite stories occupationally of how overactive bladder was affecting somebody was a gentleman that we took care of who worked at the TV station. And he spliced in live commercials during sporting events, and so basically he would have to always be focusing on what's happening because the commercials come at different times, so he had to always be ready. But the problem is he had to go to the bathroom like every 30 minutes, and so it just became very, very difficult. Even though he was really good at his job, it was difficult for him to concentrate and focus on the job and be present, be physically there to do that. The quality of life metrics that are oftentimes used in these different research studies, the most common one is this test called SF36. And so what we generally see from that, and I'm going to post an image of this in our show notes after this, is that each one of those things that I mentioned are below normal. So every single one of those things are below normal for somebody who has this condition, overactive bladder, meaning it really affects every aspect of their life. It doesn't just affect how they feel about themselves or their social functioning. It affects everything, and that's why treating it and taking care of it is critically important. And so actually, in this, we've talked all about different therapeutics and things that people do to help themselves, whether it be pelvic floor therapy, medications, supplements, Botox injections, all the way up to, what we do, which is called sacral neuromodulation. But a lot of those research studies actually look at quality of life because it's so important to see, does this medication, one, have any side effects? Two, does it help you in a good way? And then three, does it really improve your quality of life? And so that's really important if you're thinking about taking any kind of medication. Okay, so why does managing overactive bladder improve your quality of life? And so, the various dimensions I'm going to talk about again. Physical health. Obviously, if you are able to get out and walk around the block physically, that is a huge benefit to you psychologically, physically, in your body. Everything. It makes you feel better emotionally. And then, sleeping better at nighttime, waking up less times, huge benefit. One of the most important things that, we do in our lifetime is actually sleep. And then just, let's say, physically reducing incontinence episodes, very, very important. Additionally, let's look at reducing urgency, the strong desire to use the bathroom. It goes without saying on a road trip, or just driving across town, or driving on the freeway, or being at home. All of those things are critically important. The second thing is emotional and psychological well-being. So certainly there is really good research on anxiety reduction. If you feel like your body's out of control and you don't have the wherewithal to control when you go to the bathroom and how you do it, it creates an extreme amount of anxiety in your house, and especially when you're leaving the house. Once you begin to maintain control over that, obviously your anxiety levels start to go down. The same thing goes along with depression. And what's interesting is anxiety, depression really go hand in hand with sleep problems. And so if we can just improve your sleep, it actually will improve anxiety and depression. What about self-esteem, enhancing that self-esteem? Well, that leads to all sorts of other benefits, because if you don't have the self-esteem or self-confidence to leave your house, all of a sudden you're leaving kind of the world outside, and it's really difficult to engage in important relationships, which goes into the next aspect of social life. With better symptom control, you're more likely to engage in other social activities without a fear for accidents or other issues. And so this becomes critically important because we are all very, very social creatures. We need those social interactions. And so, not only in, let's say, if you're married and your spouse still is with you, you're getting some of those social interactions, but we actually need more. And I've been struck with, in my own marriage, how my wife she does a really good job at maintaining social interactions with other women. But that's critically important for her overall health, and I would say for each one of us. Improvement in intimate relationships, you might think that that's not, a big problem, but if you have that desire, it's important that you can act on that. Okay, looking at work life and productivity. So, you might be done with your work life and retired, but that doesn't mean you don't have productive things that you need to do. And obviously having accidents and not being in control of your body really affect those. So it goes back to, if you are working, you want to be that, like I talked about, that gentleman who at the TV station, one of the joys in my line of work is we get to help people who've tried all sorts of things, and then we get to help people have a drastic improvement. Saw a gentleman today just who walked out the door, and so he's a couple weeks after we implanted this little device to help his bladder symptoms. He's tried all sorts of other things. He's seen all sorts of other doctors. He's now at 80% improvement. So he is sleeping better, he told me. He's waking up once per night. He's able to engage in other activities. He's getting outside the house. So he's doing all these things that have been limiting him. That other gentleman that works at the TV station, he was a really fun person to take care of, because when he first tried this therapy called sacral neuromodulation, his mind was actually blown. He's like, I can't believe this is how other people feel. I've always had this problem ever since I was young. I've always struggled with this, and now I feel like a normal person. And so for him, it really, probably means the difference between him really succeeding in his career versus him having setbacks and not getting the promotion that someone else might get who can sit there and actually do the job. The next one is overall life satisfaction, and that's probably what we think of when we think of the word quality of life. But one of the things we do is we look at this score as a global score. How was their quality of life beforehand, and how is their quality of life now? One of the things that I mentioned before is we look at this SF36 score. And so I mentioned to you that people who have overactive bladder, they generally will score about the same level as somebody who has severe rheumatoid arthritis. Rheumatoid arthritis, as you know, affects small and large joints and really prevents you from moving, and it also is a disfiguring condition. And so the differences with overactive bladder, people don't know that you're suffering most of the time. It's more of a hidden disease, but it really affects your ability to interact with people, for you even sometimes to move, get outside the house. There's been pretty good research study looking at quality of life metrics. The best thing that we have so far for helping people with overactive bladder, for improving your quality of life, the best thing that's been researched so far is the thing that I specialize in, sacral neuromodulation. And so what the studies show is when you have a 10-point change in these numbers as you add them up, if you can just change 10 points, that means it will be a noticeable improvement of your quality of life. And this looks at overall quality of life, concern, which is more like anxiety and how you feel about yourself, coping, sleep, and social. So it looks at each one of those things. And what this found is not only do you get a 10-point reduction in each one of those things, and so remember, 10 points is what is very clinically meaningful, meaning this person noticed a difference and it's really impacting their quality of life. This therapy does a 3 times improvement in clinically motivated or meaningful improvements. So what that means is, let's say you take a pill and it's 10-point difference, clinically meaningful. It's like, okay, I'm going to keep taking this because I can notice that it's really making a big difference. This is changing things by 30 points, but it's 3 times whatever people normally feel is meaningful. And so for many people, this becomes a therapy where their quality of life is drastically changed. So my point in telling you all this, if you're suffering from overactive bladder, it drastically affects quality of life, and that might be obvious to you. But there is lots of research saying that there are good reasons that you should treat your overactive bladder or manage those symptoms. The best research and the best long-term benefit certainly seems to be with this treatment called sacral neuromodulation. But if another treatment works for you, then I would say go for it. Like, I'm for you. Anything that works for you and gives you improvements in quality of life, I would say you should absolutely go for those improvements. That is our program for today. And I just want to say thank you guys. Happy 4th of July. God bless you. And I hope all of you have a meaningful difference in your quality of life and meaningful improvements in your relationships, your friendships, your ability to engage in all the things that you want to do. Thank you so much, and we will talk again soon. Bye-bye.